How do you know when it's time for hospice? Or maybe you're asking yourself, would I be eligible for hospice? Here are some questions you can ask yourself. This video will be broken up into 4 different parts. The first one will talk about, is your condition life-limiting or terminal? The second part will be, are you showing signs of decline? The third part will be specific diseases and what they need to show in order to be eligible for hospice. And the fourth and final section is the most important part. In order to be eligible for hospice, you need to have at least 6 months or less left to live, plus other criteria. So how are you supposed to know if you have 6 months or less to live? 1, a doctor could tell you, but 2, if you don't have a doctor telling you, these are the diseases that we typically see on hospice, or at least the type of diseases we typically see. So 1 is pretty obvious, cancer. If you have some kind of cancer, some kind of metastatic cancer, meaning advanced cancer, you could possibly be eligible for hospice. 2 is any kind of cardiac condition, so any kind of heart condition. Now those are usually life-limiting illnesses. They eventually become terminal. It just depends on how advanced the disease is. 3, and this is something I talk about all the time, dementia. There's different diseases under the umbrella of dementia, like Alzheimer's, or different types of dementia, vascular dementia. So depending on what type of dementia you have will determine how quickly it advances and if or not you're appropriate for hospice, which I'll get into a little bit later. The 4th category is usually respiratory diseases, so things like COPD or emphysema. Again, those are chronic, life-limiting illnesses, but you can live with those diseases for a very long time. Now, you can become appropriate for hospice with those diseases, but it usually takes years. So understanding when is it time can be difficult, but hopefully throughout this video, I'll help explain that a little more. Stroke is another category that can make you appropriate for hospice. However, it is more complicated. It depends on what kind of stroke you had, what are the effects of the stroke. So I would work with your doctor about whether you'd be eligible or not. Now, there are other diseases that you can be on hospice for, like end-stage liver disease, which is usually a chronic condition, or ALS, or Parkinson's disease. Again, all of these things are usually chronic, life-limiting illnesses that eventually you can, if you choose, go on hospice. So that's the first part, knowing if the disease that you have is terminal or life-limiting and what the progression is, and that's something you can talk to your doctor about. The next question you can ask yourself is, are you showing signs of decline due to this disease? So you have to remember, technically you're supposed to have less than 6 months left to live in order to be eligible for hospice. Now, do we know for sure that's true? No, but there are signs we can see per different diagnosis that may show that you are likely getting towards the end of your disease process. And those signs are usually something like functional decline. So you were able to get up, go out of your house, drive, do errands, kind of live your normal life. Now it's hard for you to leave the house. Now maybe you sleep a lot more than you used to. So you used to sleep the typical 8 hours. Now you sleep 10 hours and you nap twice a day. Maybe you've noticed that you're not eating as much as you used to, or you have no appetite. You're losing weight without even trying. A lot of those signs can show us that you are in decline. It doesn't necessarily mean you have less than 6 months to live, but it's just something to look for, something to notice. Other things that you might see are increase in symptom. For example, if you have a respiratory disease like COPD, is your shortness of breath increasing? Are you now short of breath just when you're talking? When before it was you had to walk, a few steps and then you got short of breath. Now all you have to do is say a few sentences and now you're short of breath. That's a sign that your disease may be progressing and you should talk to your doctor. Another thing I often see before people are placed on hospice is frequent hospitalizations. So in 1 month, they've been in and out of the hospital 3 or 4 times. That is a cue for you to think my disease may be progressing and maybe I should start thinking about hospice, or at least talk to my doctor about, is it time? And lastly, your mental alertness or your cognitive abilities are declining as well. So you feel more lethargic. You may feel more disoriented when you're waking up or falling asleep. You may get confused or forgetful throughout the day. Of course, it depends on the diagnosis you have, but that would also be a sign that you're declining and coming to an end with your disease. A few other things you want to keep in mind if you're getting like something like chemotherapy or radiation for your disease. If you get to a place where you're no longer tolerating those treatments, this could be a sign that your body is saying no more. And maybe you are ready for something like hospice. Again, that's something you have to talk to your doctor about, but just keeping in mind, how is your body reacting to the treatment it's been getting? Also, if you no longer want the treatment, or you no longer want to go to the hospital, you're sick of doing that stuff, that's also up to you and something you can talk to your doctor about. Now let's talk about specific diseases and criteria you need for specific diseases. Now I cannot sit here and tell you every single criteria for every single disease because we'll be here all day. But what I will do is try to give you generalizations for some of the diseases that are most talked about. So cancer, advanced cancer really is something that is, I think, easier to get onto hospice for because it's easier to see that someone has less than 6 months to live. So if you have advanced cancer and your doctor is telling you you no longer meet criteria for treatment, or you're saying, I don't want any more treatment, generally speaking, I would seek out hospice and see what they say. I do feel like generally we allow most people with advanced cancers on hospice. The harder diseases to get people on hospice, where they actually might not meet criteria, are things that are more general, are things that are chronic, life-limiting illnesses like dementia or COPD, CHF, congestive heart failure, something like that. Those things have specific criteria. So let's talk about Alzheimer's or dementia because I get so many questions about that. It's actually hard to get on hospice with that disease. You have to meet a lot of criteria to prove to Medicare, because that's who hospice is working for, that you have less than 6 months to live. So here is typically what an Alzheimer's dementia patient would look like if they were to be eligible on hospice. So they're usually bedbound, so they cannot walk. They mostly are not speaking. So only a few words here and there, maybe yes or no's. They are sleeping more than they are awake. And the big thing that we need to prove and show to Medicare is that they have been in the hospital within the past year due to some kind of aspiration pneumonia, UTI, like a severe UTI that led to sepsis. We have to basically prove to Medicare that you are getting towards the end of your disease. And usually that means frequent visits to the hospital, frequent infections, maybe some aspiration pneumonia. If you can get an albumin level, like if you get their blood drawn and their albumin levels below a certain point system, then we can also prove that there's some malnutrition in there. I don't think it's great. I wish everyone could just come on hospice, especially if they need it, but technically speaking, it's hard to prove to Medicare that someone with dementia is nearing the end because, as you know, people with dementia can live a long time. Even if they're fully bedbound, not speaking, need to be fed, they can still live a long time. So that's generally speaking what the criteria is. You have to be very, very, very advanced in order to be appropriate for hospice if you have that disease. Okay, and the last and most important part of this video, something to ask yourself is, what do you want? That's what's important. Not only will you be eligible for hospice, but do you actually want hospice? Understanding what hospice means, what they can give to you. You do get a lot of things from hospice, but you lose things. You aren't supposed to go to the hospital anymore. You aren't supposed to, or not supposed to, you can't get chemo, radiation, procedures, and you lose some things when coming onto hospice. So it's important to know what you or your loved one want. What did they say they wanted? Would they want to be at home? Do they want comfort measures only? So it's important to know what you or your loved one who's going onto hospice want. And if it's what they want, then advocate for your loved one. And if you don't make it on the first time, you can always try again. Or if you do get on hospice and then decide you don't want to do it anymore, or you do want to go to the hospital, you can always come off hospice. Just because you sign up doesn't mean you have to stay on. And remember, if you're not happy with your hospice, you can always switch to another hospice. The most important thing you can do is to be educated about the process, advocate for yourself and your loved ones so you can live better and die better.